welcome to part 2 of Introduction to Medication Safety. So before the break, I asked us to reflect for ourselves the reasons why we are studying medication errors, and I hope you've had the opportunity to do that. So we talked about the NHS England Medicine Safety Improvement Programme, and one of the recommendations is to encourage reporting and learning from errors. And before we start to do that, it's really important that the right culture or the right environment is there to enable reporting and learning to happen. And that's really the focus of part 2 of this lecture, where we describe a punitive culture, a no-blame culture, and a just culture. So what is a punitive culture? This is where blame and punishment prevails. It's a culture of fear. So people are afraid to report errors and raise concerns because they are afraid that they will be punished and blamed for problems, for errors. And when that kind of culture is predominant, it encourages people to hide, to conceal when something goes wrong. And this is really problematic because we start to lose opportunities to learn from these errors. And it has wider implications, not just on that person and the immediate patient or incident, but also wider implications on others as well. Because as we will learn later on, that the information that is gathered from error reporting are used to then develop more national solutions. So this is the kind of culture that we want to move away from. And really, this punitive culture perhaps is stem from these two myths that example of these myths that I've just put on the slide. The perfection myth, where we think that if we try hard enough, then we're not going to make mistakes. Or the punishment myth, where we think that if we punish people when they make errors, then surely they're not going to make errors again. They will make fewer of them. But as Professor Lucian Leap says here, that human beings make mistakes because the systems, the tasks and processes that they work in are poorly designed. And this is really the crux of the matter, isn't it? That despite multiple interventions, people still make mistakes. Despite all the different things that have been put in place, people still make mistakes because of the way that their work are designed. So we talked about the punitive culture, where it's about blaming. And this next culture, the no blame culture, is almost like the polar opposite, where actually we're not going to blame people because, well, it's not their fault, is it? It's the system's fault. But that's not what we're trying to say here either. This no blame culture provides, it's easy to be abused because people will start thinking, well, I'm not to be blamed. And so there's blanket immunity, and that results in lack of accountability. And fundamentally, it's just unfair because, somebody does need to take accountability and be responsible. But as I explain later on, it's not solely the individual's fault, if we can put it that way. And if we have a no blame culture, people start to become complacent as well. So this is, again, a culture that we are wanting to move away from. So not a punitive culture and not a no blame culture. So what is the kind of right culture that we want to engender? This is what we call a just culture. And this is where there's openness, where there's transparency about errors, and the ability to discuss about those errors as well. This is the just culture, is a culture where there is a reporting culture, that people are able to raise concerns as appropriate. And a learning culture where people can learn from their mistakes. And altogether, an open reporting and learning culture creates a safety culture. And this is the kind of culture that we would like to move towards in healthcare. So how do we embed a just culture? How do we create this kind of culture? First is a commitment to the principles of getting the culture right. So this is, about the safety culture, and a just culture is fundamental to having the right culture within healthcare. So it's about embedding these principles into our attitudes, our behaviors, our practices. So how people work, but also in the design. So design of legislation, regulations, standards, policies, and systems. We also need to start to recognize where the right culture already exists and encourage and build upon those things as well. And where there's room to improvement, to get the infrastructure right. So for example, if people do not know how to report errors, then providing those avenues for them to be able to report errors. Or if, for example, people are unable to talk about it because there's no space, no forum for them to talk about errors, then creating one would be, for example, providing the infrastructure. As you can see, and you are aware that this kind of culture is not going to happen overnight. It's a continuous and evolving thing that healthcare professionals within healthcare systems would need to be continuing to do and to learn from each other over time as well. So, a just culture and patient safety incidents. So this is where where we start to embed a culture within the talk around patient safety incidences. So these are some of the principles where the recognition and that patient safety is paramount, and that we're not going to be tolerating deliberate harm and unacceptable risk on patient safety. This is about healthcare professionals being candid, being able to talk about their own mistakes, to raise concerns about their own or other people's mistakes, and also learning from them. And then finally, individual accountability. People do need to be accountable for their own actions, and this is done in a fair and proportionate way. Because humans are fallible and errors are inevitable. So we will make mistakes. And so the key here is to start to understand this from a whole systems view. So understanding how that individual is working within the wider workspace. So how is it that they're working within their workspaces? What is around them that is causing them and leading them to making mistakes, to incidences happening. And this is what we're calling a systems approach. And I'll be covering more of this in part 2. So just culture and patient safety incidences, and this slide just describes the principles that we need to be holding on to. And as I said, we all make mistakes, and we have, under the duty of candor, which is a legal duty on hospital, community, and mental health trusts that are registered. So these are NHS provider bodies that are registered with the Care Quality Commission, the CQC. A legal duty for these trusts to inform and apologize to patients if there had been mistakes in their care that have led to significant harm. So this is a statutory duty of candor for NHS provider bodies that are registered with the CQC. And really the aim here is to help patients receive accurate and truthful information from health providers. And really, this is trying also to create a wholly transparent culture in health provision. So being open when errors are made and harm is caused, so that both patients and healthcare providers, healthcare professionals can learn from mistakes. And we heard so poignantly about Lisa's work. So Paul's story, as asked as we watched the video early on in part 1, how it's so important for patients to be able to receive such truthful and accurate information. So that's all that we have in terms of the types of culture. And I have a task here for you to do before we go on a break. So the situation is this: a newly qualified pharmacist working in your hospital made prescription screening error. So you line manage this pharmacist. So using your learning about the punitive and just culture, I would like you to discuss the approach that you will take to respond to this incident. Why have you chosen this approach? So probably spend around 5 minutes just thinking about and writing down your answers about what kind of approach you are going to take and why. And I'll see you in a little bit.